nothing like HIV. There's no disease, no infectious disease that essentially kills everyone who gets it.
The fear factor's gone, and yet getting HIV infection is a problem for any individual. The fear should still remain because it's a virus that kills people.
There is this sense of complacency that it's better, and it isn't better. And all these people, these 40+ million people living with the virus, they will die of AIDS.
Over the past 3 decades, humanity has rallied together for the AIDS cause. People from all walks of life have united across all social and economic boundaries, joining hand in hand for one common purpose: to end AIDS.
You've probably heard a lot of confusing talk about the disease known as AIDS. So what exactly is it?
AIDS is a disease that represents the final stages of infection with an incurable virus known as the human immunodeficiency virus, or HIV. To understand how AIDS works, it helps to have a grasp of HIV. Simply put, HIV attacks and destroys cells in the immune system, much as an invading army might destroy a high wall that protects a city. With a weakened immune system, a person becomes less able to fight off infections. Before HIV can attack, it has to get in. HIV lives in bodily fluids like semen, vaginal secretions, blood, and breast milk. A person who carries HIV can pass it to another through any of these, usually via sexual intercourse, breastfeeding, or the sharing of drug paraphernalia. Rarely, a person will contract HIV through blood transfusions, and while it is highly unlikely for people to acquire HIV through saliva, it is possible to pass it through oral sex. Once the virus is transferred, it attaches to its new host body CD4 cells, or T cells, which are integral parts of the immune system. Inside the T cell, HIV literally changes to become part of the body's DNA, or genetic code. At this point, the body will be forced to produce the virus. Because HIV lives in the immune system, every time a foreign invader triggers this system to work, HIV is activated too. This means that when good T cells fight, for example, the flu virus, new HIV particles are formed. During the first days and weeks after a person is infected with HIV, he or she may experience flu-like symptoms such as a fever, fatigue, and enlarged lymph nodes. These symptoms generally disappear without treatment, but as the body is forced to create new HIV cells, the immune system gets weaker, a progression that can take from several months to more than 10 years. Eventually, untreated HIV leads to acquired immune deficiency syndrome, or AIDS. The name is appropriate. Acquired means to obtain an infection. Immune deficiency refers to weakness in the immune system. And syndrome is a group of problems that comprise a disease. AIDS is an incurable disease that is the end result of infection by the human immunodeficiency virus, or HIV. An individual who contracts HIV may become sick quickly or can live symptom-free for years. HIV and AIDS are not one and the same. Those with AIDS are infected with HIV, but people infected with HIV do not necessarily have AIDS. A person has AIDS when their T cell count falls below a measurement scale of 200, as opposed to the 500 to 1500 in a healthy person. An extremely low CD4 count means that a person's immune system is no longer healthy enough to fight off intruding viruses and bacteria. Signs that HIV may be turning into AIDS include extreme fatigue, rapid weight loss, persistent diarrhea, a high fever, and swollen glands in the neck, armpits, or groin. Even if a person doesn't have a low CD4 count, they are still classified as having AIDS if they contract any one of 26 opportunistic conditions. These are a group of illnesses that don't generally occur in people with functioning immune systems, but do show up in AIDS patients. 2 of these are cancers. One, Kaposi sarcoma, results from a tumor in the blood vessel walls and appears as disfiguring pink or purple lesions on the skin and mouth. The other cancer, non-Hodgkin's lymphoma originates in the disease-fighting blood cells known as lymphocytes. This appears as swelling of the lymph nodes. Several opportunistic conditions that confirm an AIDS diagnosis stem from invading bacteria like tuberculosis and recurrent bacterial pneumonia. Pneumocystis carinii pneumonia is a potentially deadly inflammation of the lungs that is one of the most common infections occurring in people with HIV worldwide. Tuberculosis is the leading opportunistic infection in nations where access to medications is low. It occurs when bacteria infect the lungs and can manifest as coughing with bloody mucus.
Although there is no cure for HIV/AIDS, there are a variety of drugs that can be combined to control the virus. HAART is a common treatment for HIV/AIDS, and it stands for Highly Active Antiretroviral Treatment. The classes of anti-HIV drugs are capable of blocking the virus in various ways. These classes include non-nucleoside reverse transcriptase inhibitors, nucleoside reverse transcriptase inhibitors, protease inhibitors, entry or fusion inhibitors, and integrase inhibitors. Non-nucleoside reverse transcriptase inhibitors disable a protein needed by HIV to make copies of itself. Nucleoside reverse transcriptase inhibitors are faulty versions of building blocks that HIV needs to make copies of itself. Protease inhibitors disable protease, which is another protein that HIV needs to make copies of itself. Entry or fusion inhibitors block HIV's entrance into CD4 cells. Integrase inhibitors are necessary in order for a protein called raltegravir to work. Raltegravir is a protein that HIV uses to insert its genetic material into CD4 cells. Some important primary prevention methods are to always stay abstinent, having a monogamous relationship, having protected sex, and refraining from sharing cutting blades. More than 1.1 million people in the U.S. are living with the infection. About 50,000 people in the U.S. get infected with HIV each year. 1 in 6 people living with the HIV is unaware of their infection. About 1 in 4 new infections is among youth ages 13 to 24. As you can see in the graph, HIV/AIDS is an escalating epidemic. So what does the Red Cross do to help out? The American Red Cross offers many HIV education and prevention programs. These include the Women's HIV/AIDS Prevention and Care Initiative, the Housing Opportunity for Persons with AIDS, and the New York State Department of Health AIDS Institute Regional Training Center. The Women's HIV/AIDS Prevention and Care Initiative provides support to women who are at a high risk of HIV infection or who are already living with HIV/AIDS. The Housing Opportunity provides short-term rental, mortgage, and utility assistance to those with the disease and are at a risk of homelessness. The Training Center in New York offers over 45 free trainings delivering accurate HIV/AIDS information and services. What can we do? We can ensure that people with HIV will receive treatment. We can also protect drug users from becoming infected with HIV. We can empower young people to protect themselves from HIV and enhance social protection for people affected by it.